Hi, this is Dr. Mark Trolice again, Director of Fertility Care, the IVF Center. And today we're going to continue our video blog on in vitro fertilization. Now, the last time we spoke, we left on the egg retrieval process, and so we'll continue from there. Once the eggs are retrieved, the sperm are added to the eggs in the laboratory. Now, there are two methods of fertilization. One is what we call conventional, that's adding the sperm to the eggs, and that's usually from ejaculated sperm. But the other is ICSI, intracytoplasmic sperm injection. And that's where we take a single sperm using a micropipette under high magnification and injecting the sperm into the egg. And we do that for each mature egg. ICSI has been around since the mid-1990s. As a matter of fact, the first IVF pregnancy was in 1978, and that was successful. In terms of the last 30 years or so, the advances of in vitro fertilization have improved dramatically. So the ICSI technique is used in men who have a low sperm count or who don't produce any sperm in the ejaculate at all, and we may need to go to the testes to retrieve the sperm. Now, we do that right here in the office under local with our advanced reproductive urologist so that patients have all of the services at one place. So once the sperm and the egg meet, the embryos develop in the laboratory, and we grow the embryos and call you each day with updates. The embryos are typically transferred back into the woman on day 2, 3, or 5. Studies have shown that in patients who have a poor response to fertility medication and don't have a lot of embryos actually do better with an embryo transfer on day 2. We'll go to day 3 on many patients, but the way we decide to go to day 5 is if we cannot select the lead embryos on day 3. In other words, if we have more embryos than we feel comfortable transferring on day 3 and they're looking of good quality, then we'll continue to grow the embryos to day 5. What drives embryos up to day 3 is actually the mom's genes. But from day 3 onward, the embryo's own genes get turned on. So they have a higher implantation potential. On day 3 of embryo development, more than 50% of the embryos are chromosomally abnormal. So we transfer more than one embryo on day 3 if we have that opportunity. We follow the guidelines of the Society of Assisted Reproductive Technology in order to optimize pregnancy outcome but reduce the risk of multiple births. When we let the embryos continue to grow to day 5, we'll transfer 1 or 2 embryos, but in women above 40, we'll actually transfer up to 3. And then if we have extra embryos left over, we can freeze them for a subsequent cycle attempt in the future, indefinitely. We use an advanced protocol of freezing and technique called vitrification. Vitrification has essentially made frozen embryo replacement almost, if not equally successful as fresh. Now, the embryo transfer technique is very important in the success of the outcome. As a matter of fact, the 3 most important aspects of success in your IVF cycle is the embryo, the lining of the uterus, and the embryo transfer technique. Now, the embryo, we don't have much we can do about that. That is really nature's development. The lining of the uterus, through stimulation, becomes thickened, and usually that is optimal for implantation. And then the embryo transfer technique, which we spend a considerable amount of time to ensure an easy transfer. And this is very, very important, and we do it under ultrasound guidance abdominally, but also sometimes vaginally. So those three areas are very, very important to the success. In future webinars, we're going to talk about ways to analyze the embryo through a technique called pre-implantation genetic diagnosis. And that allows for screening the embryos for genetic diseases, single gene defects, as well as the complete chromosomal analysis of the embryos, which improves pregnancy rates and reduces miscarriage. Typically, the pregnancy test is roughly 2 weeks after the egg retrieval, while you're on hormones to support the pregnancy. Until next time, take care and be well.